Hello everyone, my name is Zaki Kamal Zaki, working as urology specialist at NMC Center Sharqan, Sharjah, and NMC Center Shahba, Sharjah, and NMC Royal Hospital, Sharjah. I will speak today about the prostate gland in men. What is this organ? I will speak about most common diseases affecting the prostate. The prostate is a gland present in men only. It present at the base of the urinary bladder. It surrounds the proximal part or the beginning of the urethra in men. Its size like chestnut. It secretes about 30% of the volume of the semen. The prostate gland reaches full size at the middle of 20s. Frankly speaking, it can be between 17 and 20 grams at this age. After age of 40, it will begin to increase in size. The most common diseases affecting the prostate gland: benign enlargement of the prostate, inflammations of the prostate, prostatitis, may be acute or chronic, and cancer prostate. Today, I will speak about benign enlargement of the prostate. The benign enlargement of the prostate is increase of the cells and epithelial cells or fibromuscular component of the gland. Until now, nobody knows what is the cause of this enlargement, but we can give what happens when this enlargement occurs, what is the effect, what is the patient will complain about, how to diagnose this, and how to manage. The benign prostatic hyperplasia, BPH, is a separate disease. It is not related to cancer prostate. Both of the diseases can occur in the same time. Most of the symptoms and signs of both diseases, most of them are similar. We can differentiate only by investigations. Signs and symptoms of BPH: there will be some difficulty when passing urine. The patient may feel he must strain to pass urine. Urine stream may be less than usual. The stream of urine may be interrupted. After the patient passed urine, he may feel still there is urine inside his bladder. He wants to go again to pass urine. Many of the patients will feel they must wake up many times during sleep, more than 2 times, to pass urine. About this disease, enlargement of the prostate, the patient may not feel he can do all his job as he accustomed to do. He usually will need to go to the washroom. He will has repeated or frequent urination. He cannot go for more than 2 hours or 3 hours without going to the washroom. So he will avoid traveling for long distance, staying at a place for long time, like meeting, like cinema, like sports. So this will bother his activity. He will feel there is something abnormal. Also, one of the important things, it can affect his sexual attitude or activity. He will feel male erection will be less than usual, and there is some difficulty with doing intercourse. After the age of 50, nearly 40% to 50% of the men can have enlargement of the prostate, but not all of them will complain. They may be enlargement, but with no signs or difficulty at all. After the age of 80, most of the men will have enlarged prostate. Most of them will have signs, they will complain, but not surely 100% will go to the doctor and complain. When the patient feels there is something abnormal about his urination, his quality of life changed, he will visit, he will examine the patient physically, clinically, ask for doing some investigations and tests. Most important, he will check renal function tests, he will do complete blood picture, and he will ask about the prostatic specific antigen. It is a substance secreted by the prostate in the blood. 3 will give idea about the enlargement of the prostate. I want to tell about how to diagnose radiologically. The patient can do abdominal ultrasound, and the most important, with more details about the prostate, will be through transrectal ultrasound examination of the prostate. It will give idea about the size of the prostate, consistency, if there is any signs of inflammation, acute inflammation or chronic inflammation. Also, it can give idea about the possibility of having cancer prostate. It will appear as a nodule. There are 3 main options for management of the prostate enlargement. First thing, watchful and medical therapy. Second thing, minimally invasive treatment, surgical treatment. The third one, operative treatment or the need for surgery for severe enlargement of the prostate. About watchful and medical treatment of the prostate, if the signs and symptoms are mild and the symptom score to assess the prostate enlargement is low, less than 7, we can give the patient a chance to make some exercise to avoid excess drinking of fluids after noon, to watch what is the effect of leaving the patient without any treatment. He may continue without the need of anything. We will just observe renal functions, PSA in blood, the flow of urine. We call this test uroflowmetry. It can be done at the urology clinic, at any branch of NMC centers or the hospitals. Then we will assess every 6 months, at least every year, about the progress. The main 2 groups of drugs, alpha blockers and 5-alpha reductase inhibitors. About alpha blockers, they will decrease the smooth muscle tension. They will relax these smooth muscles. The effect of this, there will be good urine stream. The patient will not have frequency, urgency of urination. He can sleep well. He will not wake up frequently to pass urine. He can postpone urination, meaning he will work normally, and he will be able to do all his activities like normal activity. The other group of drugs, 5-alpha reductase inhibitors, they have 2 effects. They will decrease the size of the prostate gland. Also, they will have ability to decrease the growth of the gland as regards increase of epithelial cells and fibromuscular cells. There are some drawbacks of medical treatment for both group of drugs, alpha blocker and 5-alpha reductase inhibitors. They will decrease the libido. They will decrease the quality of penile erection. In most of the patients, they may complain of retrograde ejaculation when they have intercourse. Semen may not come outside. It may go to the back inside the bladder and pass with urine after this. About minimally invasive surgical procedures, there are a lot of procedures. The most important, we can use the laser beam to cut part from the enlarged gland. We can use this by many types of laser fibers and laser generators. The benefits from using the laser fibers, it will decrease the time of surgery, decrease the hospital stay. There will be very small amount of blood loss during the procedure. About TURB, the most common method of treatment, transurethral resection of the prostate. Usually we will use electric current as a monopolar electrode or bipolar electrode. This procedure can be done as a minimally invasive treatment. We remove part from the enlarged prostate from the middle of the gland. The patient after this will go to his usual activity within days, usually 5 to 7 days. Hospital stay between 1 and 3 days. We will remove part of the prostate, not all the gland. After this, the patient will able to have good stream of urine. He can do his usual activity. Some complications may occur, but in low rate. Most important of this, blood loss, infection, some difficulty with urination. He may have some incontinence for few weeks or few months. He may have some stricture or contracture of the bladder neck. He may need other operation, but very rare to do so. Third option for the treatment, invasive surgery. Usually the most common procedures done are open prostatectomy. It is simple prostatectomy. We will remove part from the enlarged gland. We will not remove the gland totally. The most common methods are through surgical intervention. We will do surgical incision. It is a cut in the midline below the umbilicus. The doctor will reach the prostate through incision of the urinary bladder. He will remove part of the enlarged. Usually it is known as right and left lobes and median lobe if it is enlarged. Then the doctor will close the urinary bladder and the skin. There will be urethral caster. It will be put for about 5 to 10 days. There will be tube drain beside the incision. It will be for 2 days up to 5 days. This is the average. The patient will be able to go home after 7 to 10 days. He can go to for his usual activity within 2 to 3 weeks. My message to all the men at the age of 50 and more, if he has any complaint like weak urine stream, difficulty when passing urine, frequency and urgency of urine, nocturia, meaning he wake up many times from his sleep to pass urine, and all of the men at age of 50 and more, they must do screening test for the prostate, PSA in blood. They must have idea about ultrasound examination of urinary tract. They must have idea about urine analysis, most important renal functions. This will be done every month. All of these procedures can be done at NMC hospitals or centers, and he can follow every year his state of his urinary system. I hope I gave some answers about any doubt about the prostate enlargement. Any man thinking he has any trouble with his prostate or urinary tract, he can meet me at NMC Sharqan Center or NMC Shahba Center, and he can do my procedures in NMC Royal Hospital Sharjah.